May is Mental Health Awareness Month, so today in Family First, we're talking about how to have conversations with our kids about mental health and what we all need to keep in mind. Joining me right now is Niro Feliciano, psychotherapist and author. Niro, thanks so much for being back with us on the program.
Oh, thank you for having me.
So as I mentioned, it is Mental Health Awareness Month. I think it's especially important right now to focus on what that means. We talk a lot about normalizing mental health, but what does that look like on a day-to-day basis? What should we as parents be doing?
This is such a good question and a really important topic right now, because as we know from all of the news articles, last week there was an article in the New York Times that many of our adolescents are struggling with mental health. And normalizing it really just means having conversations, checking in on a daily basis, making sure that they know when they are stressed that we're noticing it and we're there to encourage them and give them empathy and support.
Now, we talk a lot also about warning signs, but sometimes in the day-to-day busyness of life, we can miss things that are right there, right in front of our faces. So what do we need to keep an eye out? What do we need to keep top of mind when it comes to our kids?
Things to keep in mind are when you notice changes in your child's behavior. Are they withdrawing from things that they normally enjoyed? Are they spending more time on screens and phones, isolating? Have there been changes in sleep or appetite? And certainly mood. Now, that's a tricky one because mood fluctuates normally with adolescents. But if we're seeing more fluctuations, more frequent fluctuations, these are all warning signs that we certainly need to be having conversations and checking in with these kids.
Niro, recently I was talking to one of my daughters who said that a friend was acting odd. She just didn't seem herself. And I said to her, ask her if everything is okay. Ask her if she wants to talk about anything. And she said, Mom, that would be awkward. She would think that I was weird. And I was really shocked about this. I tried to convince her that it wasn't weird to ask somebody if they're okay. But as you know, you're a mom of 4. My 14-year-old doesn't always think believe I know what I'm talking about. So my question to you is, how can we equip our kids? How do we help them to be help them to be better friends?
Erica, as you know, 2 of my 4 are teenagers, so I fight this battle all the time. But this is actually a common issue both with kids and adults. We don't want to ask the hard questions because we don't want to upset that person. We don't want to trigger an emotional reaction and then not know what to do with it. But it is so important that we ask. And when we begin normalizing the asking, by asking our own kids, we ask them, if you were in pain and you were struggling, do you want people to express that they care about you? Now, the answer may be varied depending on the child, but I think one thing we can encourage them to do is to ask the question in a very gentle way and a non-confrontational way. How are you doing? How are you doing? Is everything going okay? I've noticed that you seem different lately, and I'm here if you want to talk about it. And if you don't, that's okay too. But I just wanted to let you know that I care about you. Mm-hmm. And they can put that into their own words. But really, we want to normalize that expression of concern and care for each other. And sometimes that begins in our own house first by modeling it with our own kids so they get comfortable with it.
Mm-hmm. Yeah, we all need some help once in a while, right?
That's right. That's right.
Okay.
Even therapists of teenagers need help as well.
Niro, thank you so much for being with us and talking us through all these important things to keep in mind.